COVID-19 has been a devastation felt globally, but has it been one that has had equal impacts on populations globally? My name is Summer Kaur, a third-year undergraduate criminologist at Lancaster University in Blackpool. And today, I'm here to share with you findings from a study that I conducted last year that examined the UK's preparedness and response to the pandemic and its link, if any, to avoidable deaths. But why was the UK experiencing such a high death toll? While it is widely enforced and accepted that a common sense framework would mean that general compliance of restrictions would be enough to curb the surge of COVID-19 deaths, the affliction of blame cannot solely be represented by public breaches alone. While the early emergence allowed room for excusing the delayed actions of the government, none of this was inevitable, despite inevidenced claims. Despite the early claim that COVID-19 was an equaliser, holding the same mortality risk alike regardless of social status, developing research swiftly revealed this to be false. And after 2 million deaths reported globally at the time of writing, and more than 100,000 of mortality rates being consumed by the UK alone, a redress must be called for the mishandling of the pandemic. Consequently, an analysis of harms is fundamental to developing an accurate picture of what is most likely to affect people during their lifetime and place them at additional risk in the midst of an unprecedented crisis. Taking a mixed methods approach to data collection, this study aimed to triangulate the responses from a generalised web survey that was made accessible to the public. It then was corroborated with the findings from those of a semi-structured interview. Findings showed a disproportionate impact on elderly generations, black, minority and ethnic populations, health and social care institutions, and those with chronic medical conditions, as reported by the Health Foundation in 2020. A common feature across many of these groups is their statistical overrepresentation in poor housing and unemployment, limited access to healthcare and food insecurity. It is no secret that policy has long been a lead influencer on mortality and social mobility trends, yet despite its destructive consequences, similar to those of illegal acts both locally and globally, continues to escape the purview of criminal law. While evidence gathering continues, existing research today is transparent in delivering the empirical message of necessary course correction moving forward. There will be huge lessons to learn from in the way the pandemic was responded to and managed. But most significantly, the pandemic has illuminated weaknesses in areas of social protection and infrastructure, as well as the UK's capacity to prepare and plan for the future, which can no longer go ignored.